Now, the UN has warned that the USAID funding freeze could lead to as many as 2,000 new potential HIV infections per day. In Indonesia, NGOs funded by USAID have long played a crucial role in tracing and supporting HIV-positive individuals, ensuring they get treatment despite heavy stigma. But with funding now on hold, hundreds of tracers have lost their jobs, heightening the risk for vulnerable communities. And DW correspondent Sinta Zandia reports from Jakarta.
This man belongs to one of Indonesia's most marginalized communities, the LGBT community, often linked to one of the nation's silent killers, HIV/AIDS. Tama once worked full-time at an NGO as a tracer and counselor for people living with HIV. He encouraged gay men to get tested and help them access treatment, part of USAID-funded efforts to curb HIV among young Indonesians.
People who are in denial usually haven't fully accepted themselves yet. I often give them examples of other people with similar cases, saying something like, I have a friend who has accepted their condition as a person living with HIV. Over time, they tend to open up.
It is a role that remains critical in the fight against HIV, making sure that patients stay on their medication while protecting them from stigma and persecution. But after funding cuts, Tama lost his job at the NGO. While the Indonesian government provides access to antiretroviral treatment, its usage remains low. Recent data shows that only a third of people living with HIV in Indonesia receive treatment. Experts point to stigma as a major barrier. Many avoid treatment out of fear of social consequences, as HIV/AIDS is still seen as a shameful disease.
Key populations, such as men who have sex with men, sex workers, and others, are often treated as subgroups within the general population, as if their values don't align with those of society. NGOs can manage many things more efficiently than the Ministry of Health or the government. They serve as a bridge, ensuring that programs run smoothly and effectively.
Last year, USAID allocated $9.4 million to help control Indonesia's HIV/AIDS epidemic. Much of that money went to programs that focus on finding and linking HIV-positive individuals to available medication. With that funding now on hold, partner NGOs are being forced to halt their tracing programs, leaving hundreds of tracers like Tama unemployed and thousands of HIV-positive individuals unmonitored. Their hope is for the government to step in and fill the gap left behind.
And for more on this, we've invited Dr. Muhammad Saleem onto the program. He is UNAIDS Country Director for Indonesia. Welcome to DW News, Saleem. Could you give us a sense of how much of an impact the NGOs funded by USAID have had in helping Indonesia in its fight against HIV/AIDS?
Good afternoon, Christine, and thank you for taking me online on the DW TV. It's a pleasure to talk to you this afternoon. Yeah, as you have shown that as a result of the recent US decision on funding freeze of regarding the international assistance, Indonesia, as like other countries, is impacted. And particularly in our case in Indonesia, prevention services are impacted, particularly for MSM and gay population. So this not only impacts outreach programs, but also risking a decline in access to pre-exposure or prophylaxis. Similarly, this is mainly in Greater Jakarta. So through this USAID funding, which you referred to, mainly the focus is on prevention and among the key population, since Indonesia is having mainly a concentrated epidemic, and MSM and gay population and one of the population which was being reached. So the prevention services to the US government funding was mainly in Jakarta, in Greater Jakarta, which is around 30 districts. So the estimates, yeah.
I just want to come in there because I wonder if the government in Indonesia will be able to fill in that void and cover the regions that were being covered by USAID funding.
Yeah, so as I was saying, for the specific prevention-related program, it's the key population MSM, and in Jakarta, as per the national estimates, there are around 80,000 of MSM population, of which 30% was being covered through US government. So immediately after the pause in early February, we had a partners meeting along with the government. The government convened the country coordination mechanism meeting, where beside the USAID funding, Indonesia receives around 100 million for HIV response from the Global Fund. So the Global Fund related services are continuing, and also for the key population part of Jakarta and Greater Jakarta is also covered through that. So for the time being, while we are awaiting the final decision at the end of 90 days period, these populations still can access informally through the other outlets of the community-led organizations being provided through Global Fund funding. However, it certainly impacts the quality and scale of services, and as you shared in the story, so MSM population, transgender population are the worst which have been impacted in Jakarta and Greater Jakarta regions.
Right,
but also
Dr.
beside that, beside that, it's sorry.
We'll leave it there. Dr. Saleem, we have a good sense of the picture in Indonesia there. Dr. Muhammad Saleem, UNAIDS Country Director for Indonesia.